So I am Mike Sevilla, and this is your FM Revolution update. And so today is Saturday, September 30th. It is 9 p.m. Eastern. It is 45 degrees in northeastern Ohio. Can't believe this.
Oh, should we tell them what the temperature is here?
That's right, and that is Kim Yu. Hi, Kim Yu. How are you?
I'm doing great. How are you, Mike? It is a balmy 80 something outside in California right now.
That's great. And that is Alex McDonald. How are you doing there, buddy? What's your temperature there, buddy?
Well, here inland, I'm in Southern California too. It's a little bit warmer here in the desert. It was sort of mid-90s today, actually. So, yeah. But I got out early before it got too hot, so I can't complain.
Oh, and before we get started, we will do a shirt check. So this is the AFP podcast. Kim, what do you have there? Talk when you.
I have got this awesome family medicine heart here. Family medicine because we care.
And Alex, what you got?
I anatomically heart family medicine.
There you go. See?
All I gotta say.
That's right. She's showing the love here everywhere. So.
By the way, Mike, where's your shirt from? You gotta give us a little shout out.
Well, the American Family Physician podcast.
Thank you.
And go subscribe to it right now. I mean, not now, but maybe after the show. Well, you can multitask, you know. And thanks to our friends out there who sent me this, but you can order it yourself as well. So I know people have been doing that too. So thanks to everybody for joining us tonight. Saturday night. And we have a couple of topics we're going to be talking about here. Very excited. We're going to be talking about this. We're going to talk about Puerto Rico and the relief effort. My opinion, headed up by our good friend Kim Yu, who she looks stressed, but she's actually very happy. So
I am so happy right now. I am insanely happy because everything's going really well in terms of our drive for our generated drive. And so if you've been following on Facebook, you will know that we've been trying to raise money for the Puerto Rico Academy of Family Physicians, who have 400 members in their academy. And we are trying to get generators for at least 50 of them so that they can open their clinics. And the Indiana Academy of Family Physicians is kindly hosting so that we can actually raise money through their foundation. So we will be showing the link to where you can donate money for generators for our doctors. And why is that important? I mean, if you think about it, so much of Puerto Rico has zero electricity right now, and we have no power for clinics to operate. So a lot of the physicians are actually going to the shelters and helping out at shelters or at the hospitals, but the hospitals are getting overburdened. The ERs are really full. And if we can get some of our docs working to be able to see patients in the clinics instead of at the ERs, that would really take a load off the ERs and also help a lot of patients. The Puerto Rico Academy of Family Physicians, we love you and we want you to know how much we really support you and want you to know how much we want to help you, and we're here for you. We have heard from many of them who are working day and night. Many have are in severe extreme conditions with no air conditioning, little access to water, poor communications, problems getting gas for their cars so that they can go to work, and yet they're still lining up to get gas to go to work. Sometimes, an hour away just so that they can see patients. And so everything that we can do to help them would be amazing, absolutely amazing. And I have to give a shout out to Ashley Saucier from the Baton Rouge, BREAC225.org. She is amazing, along with Stacy Benson, who have been providing planes for us to send supplies. So we have sent several planes through them. They've organized the planes for us, and we've raised funds to get supplies to send to U.S. Virgin Islands also, and also to Puerto Rico. And our doctors are collecting the supplies in the airport in San Juan. Sometimes past midnight, they will go, even though there's a curfew, they will go with their family members and pick up boxes and water and supplies and aid, and then go out to distribute to different organizations and shelters, convents, lots of different orphanages and areas which are really unreached and have not received aid. And I want to repeat that again. If you can imagine being in a place where you have limited, water source, you're running out of food. And we had a story of some nuns who their family physician was contacted, and he's taken care of them for many years. And he reached out to us and said, I need canned food for this convent, and we were able to get a flight out there with food specifically for this convent and bring food for them. And just seeing those photographs brought tears to my eyes, because there were so many people suffering in Puerto Rico, and every little thing that we can do to help them will be a blessing.
So Kim, kind of back up a little bit. So how did this story get all started? Because I just started seeing your post earlier this week. Kind of give the audience here a little bit of backstory on the origins of this relief effort.
So it actually all started during the week of FMX, and prior to FMX, when Harvey hit Houston. So when Harvey hit Houston, the Physician Moms and Family Medicine group, which I lead and started about 1.5 years ago, we now have about 2,700 or 800 members, close to 3,000 members, physician moms and women who are family physicians from around the world, came together, and we had a shirt drive, and we raised money and funds for hurricane relief for Harvey. And during that time, I met a physician who was involved with BREAC225.org, Stacy Benson, who's a family physician, who was furiously raising money for funds and supplies for Harvey, and also eventually Irma, and then now for Maria. And so as this whole past few weeks have gone on, we've thought, and the Puerto Rico Academy is so close to my heart, with 17 years of going to the Congress of Delegates every year, and those first few years when the Puerto Rico Academy used to have their own reception at our Congress of Delegates. And they were the first people to teach me to really salsa, and dance, and invited me to the island, and I got to stay there and really get to know some of the physicians in the academy. And so when Maria hit, it just broke my heart to see the devastation. We had just been there a year or two before, and to see the devastation and to know that, wow, I know what it's like when we had no power for 1 week in Michigan. I was doing like pap smears by, flashlight, and we had candles in the office trying to see patients, and it was insane. And I can't imagine what that must be like for months. For 4 to 6 months. And so I contacted several of our friends in the Puerto Rico Academy, Marina and Louise Perez-Thoreau and Leslie Hoy and Jorge Mu, and some of the delegates and offices of the Puerto Rico Academy. I contacted them directly and asked, how are you? Are you out of the country? Are you out of Puerto Rico? Are you off the island? Or where are you? Are you staying? And to hear their stories and realize that we have so many physicians there who have no power, who have no access to clean water, or for the ones that do, their extreme working conditions where they have to drive so far to get to work, was so tremendous that I thought, well, we've got to do something. And so initially it was just trying to connect people. So to connect the Puerto Rico Academy for the Physicians with Ashley Saucier, with the Baton Rouge Coalition, Physician Relief, and with all the different Facebook groups. And so there's where social media comes in, right? The power of social media, where we see how we can connect people from around the world, and specifically from Puerto Rico to Baton Rouge, to Texas, to New York, to Florida, to all the different places now, Connecticut, all the different parts of the country that have come together to help the physicians and communities in Puerto Rico. And when you hear the stories that come back, when you see the joy of people who receive water, we've got photographs of, and I can show pictures of communities where they're getting water, and you think, wow, we take things so much for granted, right? So right now, I decided we're going to try and get generators for our physicians so that they can open their clinics. We would love to have extra money so that we can get satellite phones as well, because many of our physicians are in areas, even the Puerto Rico Academy of Family Physicians does not have electricity at their office. So if we can get the office up and running, that would be fantastic. And for many of the physicians in the academy who are on the board, they're actually at the convention center. They're working with the Ministry of Health. They are coordinating the efforts for the whole area and for the whole island and all the different municipalities. And so we need to help. There are brothers and sisters in family medicine, and we really need to help them.
Yeah, just trying to kind of spread the word here a little bit. And so, yeah, Alex, let me bring you in here to part of this discussion. So as you've been kind of seeing this unfold on Facebook, which is kind of like a whole different discussion about social media, like what's been your reaction, and have you been hearing from people on this effort, or on Puerto Rico in general?
Yeah, no, to kind of step back to kind of how it all started with Kim, when we were at Congress of Delegates, I was actually talking to some good friends from the Houston who had just kind of made it through Harvey, and kind of hearing about what they experienced and how Facebook really connected them in so many different ways. Like, they were able to reach out to one another to check on family members, and even the stories coming out about how people use social media to find help, to ask for help, when the emergency services were just completely overwhelmed. They were able to use social media to kind of reach out, and people were able to get them help, even if they were thousands of miles on the other side of the country. They were able to connect. It's just amazing, the power of social media and what it can do. And then, fast forward to a week later with Hurricane Irma, getting the updates from Florida. I watching the Facebook live feed with some of our family medicine colleagues in Florida, and then now seeing the devastation in Puerto Rico. And I think the problem here is that because there's no power, there's no social media, there's no telephones, they're so much more isolated. So I think the word really isn't getting out as much as it needs to. And I think now, finally, a week later, we're getting, trickling out more and more about what's actually going on in the actual devastation. And I'm so proud of my friend and colleague, Kim Yu, for everything she's doing here and really spearheading the effort. And also our family medicine colleagues on the ground in Puerto Rico as well. So it's heartbreaking, and I'm so proud to see our academy come together and support one another and really support the patients, because that's the power of family medicine. We're able to do so many different things in a time of crisis and coordinate care, because we have such a broad scope of training. We're able to really kind of jack of all trades when it comes to disaster response.
I actually have a message from Carlos Sestero, and apologies if I say it wrong, Carlos. He's the president for the Puerto Rico Academy of Family Physicians. And I asked him specifically, what does he want to say? And he said, I think it is important that we as family medicine are doing what we are known for helping communities in need. We are grateful for all the help we have received from other chapters, other specialties, and organizations during this crisis. There's still lots of work to be done, and we need to continue receiving support from the mainland. For such a short time to prepare, we as an academy have accomplished a lot. We have made collaborative alliances with other residencies, not just family medicine, but also internal medicine, PMMR, pediatrics, and local government. Dr. Luis Perez visited 1 to 2 elderly centers and took boxes and water to them. Dr. Helene Torres also visited a children's foster home and took provisions to them as well. And the president actually went to the Hospital del Niño, a children's hospital, which is a foster home, and took, supplies like diapers and wipes that they had specifically asked for. We have lists from other hospitals, medical centers that will be packed and ready to go tomorrow. And Helene Torres, I have to say, she is a superstar. She was one of the ones that went to the airport after midnight to collect a lot of the supplies too. Helene is working hard in order to get everything sorted out and either be picked up at the point of delivery or to be delivered to where help is needed. It hasn't been easy. We have our ups and downs, but we will continue working for Puerto Rico. Thank you so much. And I wanted to show you some pictures. This is one that I just got. I don't know if you can see, but there's Dr. Torres with some of the supplies. Here's another one, and this is actually one of our pediatric graduates who is having an experience in community medicine, especially with those who are less fortunate. He was put in charge of a mobile clinic, and our team has been working with him as well. I have this amazing picture of many of our friends that you will recognize, Sonia and Louise. Can you see? I don't know if you can see, but if you can see, this is in the dark. They have flashlights on their heads because they're looking at medical supplies and trying to inventory everything and sort things to be brought around the island. So thank you so much for your hard work. And we're thinking of you, and we are here, and we're going to get you those generators.
And Kim, I think one thing to point out for some of our listeners who may not be aware, when I first heard this piece about generators, I was like, okay, that's kind of weird. Shouldn't we just get them supplies? But many of these areas are expected to be without power for 5 or 6 months, if I'm not understanding. And that's really the goal behind the generators is sort of a short-term as well as an intermediate-term solution to really help these doctors do what they do and care for their communities. Is that correct?
That's correct. I mean, if you think about it, 6 months of not being able to see patients, where are they going to go? You know, a lot of them are going to go to the ER, right? Or they're not going to get seen at all. And we need to keep continuing to take care. And they can serve as beacons in their communities. They can be the point people. They can really check up and make sure that people are checking in, making sure that those shelters in that area are really okay, that they have the supplies that they need. If we can make sure that at least 50 areas in around are good to go, and we can have people check in, that would be a huge help. It's definitely not where it needs to be. We need our government to really kick in and do more. But for now, this is what we can do. And I'm proud of the American Academy of Family Physicians and the chapters of the Academy. I want to give a shout out to the chapters that, can I do that right now? I'm going to ask permission, Mike.
Oh, please. This is
okay.
Your show.
This is like, oh my gosh, let me give a shout out. I am so, the first person that I really want to thank is Missy Lewis from the Indiana Academy of Family Physicians. You rock. Thank you so much for reaching out and for allowing us to donate to the foundation and to have 100% of the proceeds go to generators for our physicians in Puerto Rico. They are kindly also picking up the 3% transaction charges, which, they don't need to do. And I just want to say thank you so much, Missy and the Indiana Academy for doing that. I want to say shout outs to these are the chapters so far that we have. I would love to see everybody else join us. But the Texas Academy of Family Physicians, the North Carolina Academy of Family Physicians, the California Academy, the Florida, yay! I can see Alex and I doing it. Yay! Thank you so much. The Florida Academy of Family Physicians, thank you so much. We have the New Mexico Academy of Family Physicians. I know that the Kansas Academy is meeting this weekend, and I really hope that they'll join too. And DeMoore, Brown, Hicks, and Kessler, thank you so much. We have some big donations from Dr. William Tortonello, Jack Chow, Xiomara Santos, Pamela Chung, Amanjit Kaleka. I am so sorry, I can't say your name properly. Bernard, Richard, Dr. Cullen, Alden, Bender, Stewart, a lot of our board members, a lot of our friends from around our FM revolution. Thank you so much, because so far we have raised, you want to know how much we've raised so far? Enough for 19 generators. And so that's amazing. We have over 19,820. I would love to see over 20,000.
Actually, I know this sounds like a telethon. I just hit refresh right now.
Oh my gosh. Oh my gosh. Tell me now.
So we're over 20,000 for 20 generators.
Awesome.
Breaking news.
Breaking news. We got 20. That's amazing. And we have 2 that are going to be going. I'm trying to get 3 on a plane. Billy, my man at the airport in Houston, Hobby Airport. Thank you so much, Billy, because he's going to get us 2 of our generators on a plane on Monday to San Juan. And thank you to Gringos and Chimichangas restaurant for giving us the plane to get these generators over there and all the supplies. Thank you so much. We want to say thank you so much also to Dow Chemical. I think it's Dow Chemical or Dow Core. I think they're the same thing. But anyway, Dow, you rock. Thank you so much for helping us with supplies. And I know that we're trying to get Delta and lots of other airplanes involved to help us get supplies to our doctors. So thank you so much. And a big shout out also to Costco. We love you, Costco, and we're hoping that we can get your generators. So there you go. 20. Let's make it 50.
That's right, kids. Make it 50. Let's. We're going all night here. I'm not going to bed.
I need to get permission.
Keep calling right now. No, I'm just kidding. But no, that's incredible. I mean, Alex, just the response of our community. Like speak to that for a little bit.
Oh, I think this shows the heart of what family medicine is, that we care for each other, we support one another through good times and bad times. And it's just, it's inspiring. I have no other word for it. It's just inspiring. I don't know what else to say. That's all I got.
And we have 10 people watching us right now.
Yay! We love you. Thank you so much for watching.
I can't believe this. This is just.
I'm like watching us. It's so like surreal. I'm like, whoa! This is awesome. You guys are amazing. Thank you so much.
It's like a Facebook Live inception of like a Facebook Live within a Facebook Live within a Facebook Live.
That's right. Yeah, there's going to be some kind of slow motion coming through the screen.
Exactly. Just like go sideways and anyway, sorry.
So Kim, do you ever sleep? I mean, is that, because you've been working on this continuously for like 2 weeks now. What is happening? Like, it's awesome.
I'm pretty tired, I'll be honest with you. And in addition to this, I am working for those watching from my work. I am working also. So we're really busy. And we have this big meeting next week, a partnership meeting next week, and I've got to prepare for that. So it's been crazy, but I feel blessed. I'm very thankful that my family have been very supportive. And when you just hear the stories that come out from Puerto Rico, you just have to do something, right? And so I think that I can sleep later. It's all good. Makeup fixes. Really, I have really bad bags right now. If you were to look at me right now, you'd be like, oh my goodness, look at those bags. But magic of makeup and good lighting.
There you go. Yeah. And, we're not in HD, so it really doesn't matter. So I think,
I love that we're not in HD.
Can you see my pores? How do my pores look, guys? I missed a little foundation, I think, before I came on.
Makeup. So yeah, still 10 people. So it's awesome. So Kim, so you have a contact in Houston then so you get the stuff there, or somebody gets the stuff there and then they fly it out? Like, how does that all that work?
So this has been a whole, wow, it's kind of like a mind-blowing experience. I never realized that I would know so much about planes and generators and everything, and satellite phones. Like recently, it's like satellite. I never knew about them, but we have several generators that are on the ground in Houston, and one that was donated, and hopefully 1 or 2 more that we can purchase thanks to some of our Texas Academy physicians. So we're trying to get those on a plane that leaves on Monday, courtesy of Gringos and Jimmy Changa's restaurants in Houston. We have 50 generators on hold in Puerto Rico itself, courtesy of Costco. So we're trying to ensure that we have enough money to be able to purchase those straight from Costco. I have talked to multiple different people from different generator companies, and I'm waiting to hear back from another generator company to see what they can do. Unfortunately, the deals that the generator companies were not as good as the ones that Costco could give us. And not only that, in terms of speed, it would take weeks for them to get to the island, or we'd have to really try and find a huge cargo plane to be able to bring 50 generators, and each one is over 200 pounds. So it's 220 pounds. That's a lot of cargo space. And so even just the 2 to 3 that we have right now, it's going to be really hard to get over there. So ideally, if we can get them purchased in the island, it'll be easier for us to get to our physicians quicker. And that was my main goal, is we need these like now. We need these before, things get worse. And we've got to get immunizations in the refrigerator. We've got to be able to get insulin in refrigerators. We've got to be able to help our docs be able to take care of patients now. And so I would love to hear from generator companies. If they are willing to donate, please contact me through Twitter at DRKKYU. Please contact me immediately so that we can get your generators into our doctors' hands. And we have other physicians that really need, not just family doctors. I've been having requests from doctors all over Puerto Rico, and I would love to be able to help them. So the more help that we can get from everybody, the better.
And just to let people know, this is, totally, a grassroots effort that had people have just were working on this. There were reports out there, that the, AFP formerly was kind of organizing all this. That is not true. It was all Kim Yu, but, we have friends at the AFP, and, we would love, and I know some are watching right now, right? You out there, we're watching you out there. So would love to have some efforts from our National Academy to try to help out as well. With some of these efforts, and there probably are already, I'm not like, the president or anything. Not yet. In a few years. There's probably some kind of behind the scenes things that are going on that are going to make me totally look bad. But this is people, this is the power of grassroots organizing, of using social media, digital communication, getting passionate people out there, getting them in the right place, communicating with them across, oceans. And people can do this. People can do this like in the matter of days. Like I just saw this on my Facebook feed, just in the past few days, already over 20,000 just from our community. We're reaching out to other people too. It's just amazing. It's just amazing just hearing how, not only our community, but people, how they respond to people in need. This is what we do all the time. This is what Family Talks do all the time. This is what our communities do all the time. And I am continually inspired and humbled just by what our friends and colleagues and communities do to respond to people in need.
So true. And especially for our doctors that are on the ground in Puerto Rico right now. They're the ones that are actually picking up stuff from trucks and bringing it around to disaster-stricken areas around the island, because there's such a lack of transportation for the trucks to get the supplies to where they need to go and the medications to the hospitals in need. And so our docs are there, they're willing to work, and they have been working with the government on many different levels to help organize and divide the municipalities and find out which physicians are in which municipalities, which hospitals need what. It's really a remarkable effort. And I think that what's wonderful about it, really shows the diversity of scope of family medicine. What can we do? If you stick a family medicine in an area which needs patients and, which needs to help anybody, we will be there. We will do whatever we need to do to be able to help improve care and take care of our communities. And I am so proud of the physicians in Puerto Rico, all of them, from family medicine to internal medicine to pediatrics to urology, to everybody that's there right now trying to work hard to take care of their patients. Because I know many are working without sleeping, in dire conditions, worried about their families. And we just thank you so much for putting other people's needs above your own.
And then, so when we're going to circle back to this topic, throughout this whole show, but so I guess for people watching right now, Kim, so other than, going to our friends at the Indiana chapter and donating there, is there other things that are needed kind of right now that you want to tell the people?
Yeah, we need satellite phones. So if someone wants to help us with that, that would be really great. If you know people that are in that business, or ham radios even, I mean, we need communication, electricity, and water. Those are the main things that we need. We need supplies. We need insulin. We need flu shots. We need IV bags. We need saline. So much medication. We have a whole list that was given to us by the government, and also by different hospitals, also by individual physicians that are asking for help. And so if you have ways and means of being able to collect those, especially if you're in, right now we have planes that have been organized through BREAC225.org and Ashley Saucier's group, and many others around the country. We have planes hopefully leaving from New York, Connecticut, Miami, Atlanta, and Houston. I hope I'm getting these right. So especially if you're in those cities, please make sure that you contact us. Let me know so that I can plug you into the people who have those planes, and we can get those supplies to our physicians in Puerto Rico. It may seem weird. You're like, well, why can't we just buy it there? The problem is that the supplies chain is really broken. And so we have planes already that are going to be going out there that are not full. And so if we can fill them, we should try our best to fill them. So if you're able to join some of the Facebook groups, there's another group called Doctores por Cuas. I don't know if I'm saying that right, but I will post links later. There's also Physician Relief Network. They are amazing groups on Facebook that are also doing so much for Puerto Rico, and need to, you need to plug yourselves into those. I will say, for those that want to go to Puerto Rico, please be aware that there are certain needs that they're asking for. They are asking specifically for those in primary care and in surgery, specifically, and critical care right now. So if you're in those specialties or subspecialties, please contact Physician Relief Network and some of the other groups so that we can get you where you need to go. We are asking for at least, if you can stay at least 2 weeks to 4 weeks, that is much better than going for 1 week. And know that you will be staying probably at the hospital in really dire conditions. So be prepared for that. This is not your luxury, go to the beach type of vacation. This is really going to be really difficult. You will be sent to areas that are hardest hit, that have very little transportation, communication, and electricity. And so be prepared for that. So we need batteries, we need fans, we need all sorts of things like that. So if you are interested in collecting supplies, even in California, if you want to do that, that would be amazing. And most importantly, donate to the Indiana Academy of Family Physicians at http://in-afp.org/give. Did you get it?
Oh yeah.
Okay.
It might be easier just to go on the Facebook and the Twitter feeds and find that link. But yes, we got it.
All right. So Alex, so we will circle back to Kim. We will give her a little break from talking, because she's been talking for 30 minutes. So we were gonna, and don't nobody go anywhere, because we have an exciting topic too. So we're talking about National Primary Care Week starting tomorrow, October 1st. So Alex, what do you have for us about National Primary Care Week?
So National Primary Care Week is probably my second favorite week of the year, only behind Congress of Delegates and FMX. But that's just because I'm biased. So National Primary Care Week is originally started in a couple of years ago by the American Medical Student Association. Basically, and the goal was to really engage particularly physicians in training and medical students across the whole health spectrum about primary care and the importance of primary care, and how primary care is really sort of the foundation to the entire healthcare system. So regardless of what specialty you are, you interact with primary care, you rely on primary care in so many different ways. So that was kind of how it originally started. There's a whole bunch of other organizations which have now sort of got involved and got on board. The American Academy of Family Physicians does quite a bit through their Family Medicine Interest Group. The primary, drawing a blank in the name. I'm drawing a blank. Anyway, there are a couple other organizations involved that have been helping out as well. But it really, American Medical Student Association deserves sort of a shout out here as well for kind of getting this off the ground and getting this going. So they have a bunch of great events and webinars going on this week. You can go to amsa.org/events and get links to all the different things. So on Monday, Dyke Drummond is addressing burnout in the medical students and kind of recognizing early signs and symptoms and prevention techniques. He's a great speaker on physician wellness. I've heard him a couple times myself. He's a national expert on this. Tuesday, Dr. Neil Bard is doing a nutrition component, how nutrition and medicine and a healthy lifestyle are so critical. Wednesday, Dr. Joey Johnson is the AMSA president. He's doing a Facebook Live session on the importance of diversity in medicine and why it really matters. Lastly, Thursday, Dr. Smith is doing a rural health and telemedicine and talking about how telemedicine is really unique to rural health too, in terms of getting care to these remote areas where they may not have a lot of specialists or subspecialists or whatnot, and how primary care plays such a critical role. And then lastly, on Friday, Dr. James Loomis is talking about sort of lifestyle medicine, and one of my personal favorite topics, sort of exercise as medicine and engaging patients in preventive medicine, and how you as a physician can be healthy as well. So those are the AMSA events. And then the Family Medicine Interest Group through the Academy of Family Physicians is doing several events as well. Monday, they have a rural health webinar with Dr. Schmidt and Johnson. On Wednesday, they have a AFP chat for those of us who are Twitter fiends, talking with several of our leaders within the Academy. President-elect John Cullen and Board Chair Dr. John Meggs will be chatting live about primary care. And
what?
Yeah,
Wednesday?
I know. Can you believe it? Wednesday. 9 p.m. Eastern, 6 p.m. Pacific. Are you around? What's your schedule?
We're going to have to crash that, and then you and I will probably have to do like a Facebook Live commenting on the AFP chat.
I think we should do that. I think we should Facebook Live and chat at the same time.
That's right. Get people, and they can get our commentary on what the AFP leadership is chatting about, and we can debate on whether they're actually tweeting or if they're having AFP staff tweet for them.
Oh, that's a good one. We could see if they're how the GIF game is as well, if they're enough GIFs or not.
I totally asked that question. I asked that question because there was, I was sitting right behind one of the presidents. I won't say when, because then that would out them. I saw a tweet come out and I was like, hold on a minute. I didn't see the guy move. And I thought, well, how is that? So I asked the question, and he really has learned how to tweet where we can't tell.
Wow.
Tricky.
Amazing. Yeah.
It is amazing. He was sitting like this with the phone was like on his lap, and he didn't move whatsoever, and he was able to tweet. Amazing. And his head didn't even look down. It was like that. And
maybe that's what happens when you get on the board. You get a little chip in your head, and then you can tweet.
That media training is outstanding. That's some pretty outstanding media training. That's for sure.
Wow. Huh. So I'm sorry I interrupted you. So I got stuck on Wednesday 9 p.m. So yeah, what else you got?
And then Thursday, Dr. Isabel Lowell is a founder of QueerMed, and our very own Dr. Natasha Buyan is leading a webinar about telemedicine and really using telemedicine to kind of meet patients where they are. Yeah, I love her. Meet patients where they are, kind of engage communities where they are, as opposed to forcing people to spend half a day coming to the office and seeing us. And we love seeing them, but more and more, I think people are interested in telemedicine and Facebook Live events to learn more as well. So it's going to be a great week for sure.
Yeah, so exercise is good. So I was commenting on your photo that is like a half mile from your house. Like what was that mountain biking thing there, buddy?
Yeah, so it was painful. My alarm went off at about 5:50. I was on call last night. Got home around 10. Alarm went off at 5:15. Went out in the dark with some of my friends. You can actually see a headlight on my mountain bike because it was literally pitch black when I first started. Met two of my family medicine colleagues, and we went for about a 15-mile bike ride up through the mountains behind my house, which was pretty awesome. I'm not gonna lie. I only fell twice, but I'm okay. My bike is not injured, most importantly. So.
Yeah, I was worried about your bike. Your bike's okay.
My bike's okay. My leg, that's another story. The scratches will heal, but the bike, it's okay.
And you're adequately hydrated and all that kind of stuff, right?
Always camel pack. And I'm mountain biking, I always do a camel pack because that way you can make sure you stay hydrated. It wasn't 90 degrees yet, so.
Camel pack? Can you educate me on that?
It's sort of a small backpack that has about a 2-liter water bladder in the back, and there's a hose which kind of comes around so you can drink from the hose while holding on for dear life while careening down the side of a mountain. I highly recommend it. Yeah.
Wow, that's awesome.
Yeah.
And Kim, we love primary care, right? We primary care is awesome.
Yeah, I mean, this is what we do every day. So I'm really excited that it's Primary Care Week. I remember when they had us all doing the Primary Care Week thing and you're supposed to take a picture with it like this. This is National Primary Care Week. What happened to that? Do we need to do that right now? Like I'll have my little.
We should bring that
national. Back. I know. We should totally do that. National Primary Care Week. I'm going to do it right now.
All right, we'll screenshot.
It's not pretty, but.
And Alex, you have to did you look up some fun facts for National Primary Care Week?
I did. Okay, so people are like, oh yeah, primary care, yada yada yada, whatever. So our good friend Dr. Glenn Stream over at Family Medicine for America's Health, he wrote this great article a few months ago in Medical Economics talking about making the dollars and cents argument with primary care. I mean, we have, for those of you who haven't been paying attention, we have a healthcare cost crisis in this nation, really. So it's like, how do you reduce costs? How do you improve the health of our nation, and improve their care? So, he put this article together. Talks about, primary care. A robust primary care is so foundational to any healthcare system anywhere around the world. So 89% of Americans believe that a personal relationship with their doctor is really important, and that's what we do in primary care. 88% support a health system that really emphasizes prevention in primary care and keeping people healthy before they get sick, and not just paying for procedures and whatnot. So currently primary care makes up about 6% of the spending in the US, which is abysmal. Studies have shown that 12, 15, maybe even 20% of spending would drastically improve the nation, the healthcare costs in the nation. So, patients with a primary care doctor who have about 33% lower healthcare costs overall. So that's huge. I mean, you multiply that times everyone in the nation. I think there's some estimates we could save almost $60 billion a year if everyone in the U.S. had a primary care doctor that they saw and had a good relationship with. So, it's so critical in so many different ways. So, obviously I'm biased. I love what I do. I love seeing patients every day. It's a lot of hard work. And the biggest issue, which most people watching this know, is that we have a shortage. We don't have enough primary care doctors. It's not emphasized enough within our system. So that's part of the goal of National Primary Care Week as well, is to really show the rest of the medical community, rest of the country, kind of what primary care is all about, how much fun we have in primary care, and how important it is to really improve everyone's health of our communities, of our nation. And I think to bring it all back, what we're doing right now, outreach in nice, I like it, Kim. Outreach to Puerto Rico is and some of the other relief efforts we're doing is what primary care is all about. So that's all I got. I love it.
So here's what I've got. I've got primary care is the solution for healthcare in this country, and I truly believe it. I believe that we are the solution, and especially family medicine. You know, we know that a lot of family docs who do primary care, who are the backbone of primary care in this country, along with some of our colleagues in internal medicine, pediatrics, and OBGYN, they really do serve not only the needs of the majority of problems that patients face every single day, but we do a lot of the work within the hospitals, within our jail system, within the urgent cares, within the emergency rooms, so many different areas within the SNFs and hospices. Alex, you do sports medicine. I mean, there's so much that we do in family medicine and primary care that every single person in this country needs a family doctor. And I hope that if we can get that message out, that would be amazing. And if we can learn from other countries that really, as Alex has said, spend more on primary care and have better health outcomes, isn't that what we want for our families? Isn't that what we want for our country? We want to have strong, healthy families. We need to have a strong primary care workforce in place. So please do check out Family Medicine for America's Health website, and we can post the link for that later on as well.
Yeah, I totally agree. I think one thing people say to me is like, well, you can't possibly do everything. And one problem that I had as a medical student and a resident is I did want to do everything. I wanted to do everything in primary care, which is great. But it's important for people to know that, like, for example, I do primary care, but I also do have a sort of a specialization in sports medicine. But I don't do OB. I don't do any ER work. So, you know, every single primary care doc doesn't do everything, you know, because I've had people say to me, well, you can't possibly do everything well. And each one of us individually doesn't do everything, but collectively we do everything. You take 5 family docs with sort of different areas of interest and we could practically run a hospital. There's so much knowledge there. So I think that's a critical point to make for people to understand that, you know, we all do primary care, but then we all have our own area of expertise and interests. And that changes over time sometimes as well. You know, early in career, sometimes you do more OB and later you do a little bit less, and then you do more procedures at one point in your career. So for us as physicians, it really keeps us healthy mentally and emotionally as well to kind of be able to do all these different things and kind of reinvent ourselves or redo parts of our career over time as well.
Well done, friends. Yeah, I mean, for me, you know, primary care, you just substitute family medicine, and you know, because we all know primary care is family medicine. Yeah, I think Kim was talking about. I remember our friends at Primary Care Progress, and they had that huge kind of sign thing. If you,
that's the group I was trying to think of. Primary Care Progress. I'm sorry. That was my brain part before.
In fact, that's how I got to work with it. That's how for me, that's how they got on the map. They had this whole thing, and I think it was maybe about 7 or 8 years ago now, and they had the sign thing, and you know, they had an older lady had a sign. It says primary care got me this far, and I was like, wow. I mean, that's how you do a sign type of campaign. So good. Yeah. So we still have 3 people watching us. I am so excited. Thanks for everybody for hanging out with us. You guys got anything else on National Primary Care Week? I mean, just follow the hashtag. I think it's NCPW 2017 or something like that. Isn't that right, Alex?
Correct. Yeah. National Primary Care Week 2017. Follow it there. Bunch of stuff going on in the various different campuses of most medical schools around the country are doing some events this week. So wherever you are, you know, find your local medical school, see what's going on, and just show up, get involved, and on social media, because I think this group is biased, but we all love social media. Hugely powerful.
But for me, you know, I'm gonna be crashing that AFP chat on Wednesday, 9 p.m. Eastern time, and probably have some kind of conspiracy going on with me and Alex. So,
all right, don't give the secrets away. We'll figure it out.
There's only 3 people watching us, so they'll know what's going on. Kim, what do you have there?
I've got the because I'm old school, you know. I mean, I love all this technology, but here's the link again, just in case people were wondering. Please give now. And let's see how many we get by the end of the show. Wouldn't that be awesome if we could get 21? 21 by the end of the show. 21 generators, please. That would be great.
Sweet. Okay, so let's quickly do topic 3 here before the rest of these 3 people. Oh, we have 4 people now. So let's do kind of a wrap up of FMX Family Medicine Experience, AFP, in San Antonio. Alex, go first. What was your impressions of that experience and being on our social media team, which is probably the best part of the whole thing?
That was by far the best part, is being on the social media team. So I had the honor and the privilege. I feel like I am a neophyte among social media demigods working with you two, but it was a blast. I had so much fun. The Congress delegates for about 3 days, 4 days, 3.5 days. A lot of fun, great energy there. The FMX was first time I was actually stayed the entire conference. I usually had to go a day early or a few days early. This time I stayed all the way until Saturday, which was tough to be gone for a whole week from my family, but it was completely worth it. I had so much fun. I went to probably 7 or 8 different workshops. I learned a bunch, got some CME, tweeted out. I like to live tweet my lectures and kind of take notes in public, which is always pretty fun. I think more people need to do that. Connecting with people at different lectures of just who I had never met before. And then it was actually funny. I was walking down the hallway and I saw one of my colleagues who I graduated from medical school with almost 10 years ago, who I hadn't seen for 10 years. And I randomly saw her in the hallway at FMX. So that was pretty cool for me. San Antonio was a very cool city. I'd never been there before. A nice little Riverwalk area there where people can go have restaurants and dinners. And I went for a couple of great runs. I ran past the Alamo. I took a selfie at the Alamo as well. I think that's my favorite post from the whole week. So it was fun. It was fun.
All right, Kim. So party remarks. You can talk about some of your special interviews that you had during the week.
Well, I was really excited to be one of the social media ambassadors. I mean, it was such an amazing experience to do the daily live Facebook events with Mike. That was really a highlight of the week. Being able to have our upstage front seats to be able to tweet out from the meetings live, to see this guy. And Dr. Deepak Chopra to be part of that daily experience that we have, and to really hear the stories from people from around the convention center. The Medscape sponsored physician well-being wall that was there was truly remarkable to see the things that made people strong. I don't know if you guys saw that and read some of the things that were written. It had, what makes you strong, and people putting, their family, their faith, their friends, whatever it was. I remember Mike put golf, which I think is remarkable because, like, if I play golf, like, I just make holes in the grass. It's really not very pleasant. But, hearing those stories really encouraged me and refreshed me to realize that what we do every day makes a huge difference in the lives of our patients, and it was really exciting. I have to tell you a really funny story, though. I was at the airport, and you meet people at the airport who are at the meeting as well. There are thousands of us at this conference, and there was an amazing 2 family physicians that were from Hawaii, and they were amazing. And I asked them, what was the most interesting thing that they thought in terms of stuff that they got at the exhibit hall, or what they thought was the really neatest thing. And they said the socks. Like, this was apparently the hottest item at the expo hall, was everybody wanted the socks. And then
What?
I know, right? Isn't that crazy?
Socks?
I know. And so I was like, well, were they special socks? And she was like, no, like, there was this huge line for the socks, and they go up to get the socks, and they're like, well, are these special socks? And the exhibitor was like, no, they're just socks. And I was just like, oh my goodness, all these people lining up for socks. But it was really interesting to hear to hear her perspective and her joy and laughter from that moment, because they realized how silly it was that they had spent this time, but it was good because they were able to reflect on all the different things they had learned, and they were in line with other doctors and talking with them and just communing and having that moment of silliness in some way, to reflect on the joy of family medicine, the things that we do every day for our patients. I thought that was kind of funny and neat. Just one of those kind of crazy
we
things.
should have done a story on that. We should have like filmed people in line and be like, "Hey, what's up with the socks? Can you give us an insight? Like, why is the socks?" I mean, we missed a story there, man. I apologize to the audience about that.
Was there like a huge letdown once they got the socks and realized there was nothing special? Were they all like angry? Like, that's it, I quit, I'm out of here.
No, I think they were still really excited that they got socks. I mean, it was, really interesting. So I thought, that's kind of something neat to do for next year. Put it in my mind back there that socks are a hot item. It's really kind of funny. So I think that's definitely a question I want to ask, people as they're going into Expo Hall, like what little thing did you get that makes you want to go to that booth, kind of question. It's kind of interesting to see where people go in the Expo Hall. I loved, seeing the mariachi singers that they band and the different Expo celebration opening. That I thought that was really amazing. And the celebration on Friday night, the highlights of the week, where we really get to celebrate with all our different doctors, and they had artists that raised money as well for hurricane relief, and that I don't know if you saw it, but painted the Beatles, like the four faces of the Beatles, Andy Warhol style, and flipped it upside down, and it was like the Beatles. And they were able to raise a significant amount of money from that event. So that was kind of a really cool thing that they had that week. And we're really excited about next year in New Orleans, and hopefully we'll see everybody there.
I'm just excited to go eat in New Orleans. I'm not going to lie. I mean, Cajun is like one of my favorite foods. So if no other reason, I'm going to New Orleans and just like pig out all week long. It's going to be amazing.
And Kim, you want to talk about that? You want to preview, because it hasn't been released yet, your very special conversation with Dr. Matos.
Well, I have to say, it is 60th anniversary. I don't know if you can see this or if it's reversed or not. That's the 60th anniversary for the Puerto Rico Academy this year. But even more, while we were at FMX, we got to meet Dr. Angel Matos, and I'm not sure if I'm saying his name right, Angel Matos. And he is one of the oldest members of the Academy. I don't know if he's the oldest, I'm not sure, but he's definitely one of the members of our Academy who's been to our FMX meeting the most, and Congress of Delegates. I think he's been to over 50, was it 56, Mike? Was it 56 meetings?
I think so. Yeah, it was 55 plus. I know that.
And he was celebrating his 99th birthday this year, and is hoping to come back next year to New Orleans to so we can celebrate his 100th birthday and his 57th FMX meeting. But to hear his story, the reasons why he went into family medicine, the joys that he has had taking care of patients through many generations. It was a real joy, and I can't wait to see that interview. I really hope that we get to see that, because there are certain things that we can really treasure and really learn from someone with that much experience and love for family medicine.
Yeah, it was fascinating for me to hear the history and the stories he was saying. And when you were talking with him, he seemed to have a joy in his eye, talking about the past, talking about things he used to do as far as a clinician and some of the advocacy things, and a little bit of a history of the Congress, a little bit of a history of, of family medicine. And I think we need that, unfortunately. I think we need more of that. We don't get enough appreciation, enough sharing of our own history. I mean, obviously family medicine has not been around as much as other specialties, but I think we need a better, or at least I need personally, a better appreciation of our history, because we need to look back before we can look ahead.
Knowing our history and the lessons that we've learned from history, that quote where, you don't want to repeat it kind of thing. If you don't know history, then you're going to repeat the mistakes from the past kind of thing. It's so important. And hearing Dr. Matos and hearing his stories really brought home to me how every day as family physicians around the country, around the world, we have so much privilege and honor, in some ways to be able to take care of families, to hear their stories, and to be a part of their extended family, to take care of them. And you could see the twinkle in his eye, the joy he had when he talked about family medicine. It was truly special and remarkable. And I hope that many people get to see that interview, and that we get to hear more of the stories. The stories that are coming from Puerto Rico right now are amazing. They're heartbreaking, but inspiring. And I hope that we can bring those stories to you, both in Facebook updates and in more Facebook Live programs, that we can actually bring people who are there to you to talk about what it's been like for them and how we can help them. So for everybody out there that's watching, thank you so much. Please share our links so that we can get those generators to our doctors in Puerto Rico.
Before we start to kind of close up, I want to give a big shout out to our friend Ryan, Dr. New from New Care Family Medicine, who has, for some reason, has watched our entire show. And he's doing some great work out there too. I watched his Facebook Live from his clinic, and they're getting a new provider in there. So big shout out to you, sir. Direct primary care advocate and a good friend of mine. Hopefully we can get to chat soon.
His kids must be in bed or something, right?
Or it must be really bored.
Really bored. It could be, hopefully not, but.
All right. So yeah, you guys got anything else? Before we kind of close things up for the night, Alex, you got anything else?
No, just
no.
Sure
How can people find you on the internet other than stalking you as usual?
Well, I hope not too many people are stalking me. I'm at tweeting AlexMMTRI as my Twitter handle. That's usually the best way to find me.
Whoa! Can you explain your Twitter handle there, sir?
Yeah. Oh, okay, sure. So many moons ago, before I really was a family medicine doctor and realized the power of social media for family medicine, I was a professional triathlete. I raced for 5 years as a professional triathlete, and that is the. Did you not know that?
Okay, how did we not know that you're a professional athlete? I just thought you were just buff because you were just buff. I didn't realize it was because you were professional.
Wow.
I thought this question was a plant. No. So I raced. So here's my short story. As I was going to be 4 years of medical school, I started exercising, doing triathlon for my fitness and my wellness during medical school, which is obviously a stressful time. And then had more and more success, and actually took a break between medical school and residency, and raced as a professional triathlete for 4 years. I raced kind of all over the world, mostly North America. And that AlexMMTry was my website and my Twitter handle as a professional triathlete. And then when I started doing more and more medicine, social media advocacy, I just kind of kept that handle because it was there. I was already using it. So remnant of my past, but still an athlete at heart. Maybe not a professional triathlete anymore, but definitely an athlete at heart still. Hence the sports medicine fellowship as well.
Awesome. Let me see. Let me hit refresh here and see who's left here.
Yeah. How many do we have left? Well, I want to give a shout out to Carlos, Marina, Luis, Helene, Sonia, Ashley, Stacy, Adriana, Angel, Ariel, who is the Executive Director for the Puerto Rico Academy of Family Physicians. Thank you so much. Cruz, Dr. Castellano, Esther, Jorge, Leslie, Santos, Paula, Vivian. We love you.
And I know you said this already. How can people find you on the internet, especially to contact you about any relief efforts there, Kim?
So you can contact me if you want to contact me through Twitter. My handle is @DRKKYU. And that would be amazing if you could contact me through that. Also through Facebook as well. And yeah, just contact us and let us know. You can also contact the Indiana Academy of Family Physicians about the donations. That would be really wonderful. We need help to get to our Puerto Rican doctors and their patients. And so please, please help. There is nothing worse than knowing that you could be helping your patients, right? I think as a physician, I don't think there's anything more disarming like that. If you're just sitting there knowing that people are suffering, knowing that you need to be able to help them, and knowing that if you had your clinic open, you could do something. So we need to get our clinics open in Puerto Rico and get our patients seen and taken care of. Thank those who have donated. You have touched my heart in so many ways. Thank you so much. But please share our story so that many more people will know how to donate. Thank you.
Well, Kim, thank you. I mean, you're amazing. Like, I am so inspired by you, and you're spearheading this effort. So, thank you. How about that? Can I get an on my mic?
That's right. That's right. Because we can't. You and I couldn't do it because we're not that talented, and we need more sleep. So
definitely.
So we're glad that Kim's. No, I mean it's just incredible. Yeah.
Do you see I'm sleepy right now.
You never know. You never know.
Oh, thank you so much. No, it really means a lot to me. I think that we are so blessed, aren't we? We're so blessed. Walking around today, and just like we are so blessed. So thank you so much.
Big shout out to John Cullen out there who is watching us right now. So
thank you so much, John.
Hi, John.
Thank you.
We miss you.
Yeah. So he's here, and so yeah, you're awesome.
You're really amazing. Thank you so much.
And of course, Dr. Mike Sevilla, you can and I think what I'll do is I will kind of break up these video segments. I'll put it on drmikesevilla.com, put them on Facebook, recycle them so we can kind of spread the word around there. You can follow me on Twitter. And I had a lot of fun today. I don't know. We may have a little kind of production meeting after this thing here. We might be doing this again. If they can tolerate me, but we if you like our show, let us know. If you don't like our show, just let Alex know.
I would be
Love
happy.
it.
I would be happy to listen to all the constructive feedback and cry myself to sleep every night.
Because Family Medicine, FM Revolution Land. It'd be fun to kind of make this, maybe on a semi-regular basis with our friends here. And you out there may be able to join us too and to share your story, because we're all about stories here at the Family Medicine Revolution. And maybe bringing this show back, on a semi-regular basis with our friends here. Because as I've said, and as everybody says, we as family docs, we got to tell our own story. And no one else is going to tell our own story for us. We got to do it ourselves. And it's a good time. You guys got anything else before we wrap it up?
Follow the hashtag GrassrootsMedRelief. GrassrootsMedRelief is another hashtag you can follow. And we are just really excited to be working with BREAC225.org. They're doing amazing work as well. And big shout out to Dr. Borukuas, who are doing fantastic work as well on Physician Relief Network. Thank you so much again for all the different chapters of the American Academy of Family Physicians. We just are very grateful. Thank you so much.
Alex, any other closing words that I've asked you for the fifth time for closing thoughts?
Yeah, just happy National Primary Care Week. That's hashtag NPCW 2017. Check it out. Follow us on social media all week. And then maybe Wednesday night, there'll be a little excitement during the AFP Twitter chat. We'll see what's going on there.
Maybe, which I cannot take. Well, I'll probably be on Facebook Live anyway. Me and Alex will do the commentary.
Perfect. Let's do it. I'm down. Let's do it.
So if people want to watch this, I'll put it on drmikesevilla.com. I'll put it in smaller segments. You have to, sit through the whole 70-minute thing that we've been doing. But that's it, kids. So thanks, Alice, for joining us. Either whether you popped in and out or you sat through the whole thing or, whatever. I'll be putting this out on my website there very, very soon. So till next time, say bye, everybody. Bye.
Bye.
Bye, guys.